Hello, everyone. Thank you so much for joining us for this edition of Talking Kids Health. I'm Beatrice Canals. Joining me today is Katherine Schain. She is a genetics counselor here at Nicklaus Children's Hospital's Research Institute, which is part of the Personalized Medicine Initiative. Thank you so much for joining us, Katherine.
Thank you for having me.
Today, you're going to give us an overview about the role of the genetics counselor, as well as telling us about some new advancements that are taking place here at Nicklaus Children's. Let's get started because many people watching us may not even know what a genetics counselor does. What is the role of a genetics counselor?
So a genetic counselor is someone who is specially trained in medical genetics and counseling. So we have a master's degree in genetic counseling, and we can work in a variety of fields. But kind of our goal is to analyze medical and family history and determine what, if any, genetic risks are held within that. Also if someone has a family history of an inherited condition, what that might mean for that individual, what genetic testing might be appropriate, how it may affect their future health or their family members. So overall, that's the role that we play. And we can work in many different fields, and that's expanded a lot over the years. They can work in a prenatal setting, so they may work with obstetricians, working with women who either want to get pregnant or are currently pregnant. They may work in pediatrics, like at Nicklaus Children's Hospital. We work with children who have either known or suspected genetic conditions. They can work in the area of cancer for people that have a family history of cancer and are interested in predisposition testing. And then various specialties, neurology, cardiovascular, and many of us are working in industry and in laboratories now as well.
I think it's wonderful that because genetics now, people are so conscious of it, the importance of it, and that you have the ability to let them know ahead of time. You can get in early.
Absolutely.
And give them the information they need.
And ideally, the earlier the better.
Right. And what is a day, walk me through, if you can, a typical day in the role of a genetic counselor?
So it really depends a lot on the area that you work in. I happen to work in pediatrics. And so I see mostly children, and then I do see women who are either trying to become pregnant or who are pregnant. So if you were to come see me, the first thing we do in either setting is to get a good medical and family history. And what we're looking for in the pediatric setting is we're looking for anything in their history that could give us a clue as to why that child is being seen by genetics, or could there be some underlying genetic condition. And in a family history, we're really looking for anything that may help us answer that question. I always say in genetics, we're the why people. So we're trying to figure out why your child was born with various findings. So we would do that history, and then genetic counselors in pediatrics often work with a clinical geneticist. So they would work in conjunction with that person to examine that child physically, and then discuss what testing would be appropriate for that child to then hopefully then get a diagnosis or a reason for why that child has come to see us.
Absolutely. For the person perhaps already interested in contacting a genetic counselor here at Nicklaus Children's Hospital, what can they expect that first initial appointment? If you can walk me through it, and is there anything that they should do to prepare before coming to make your job easier, more productive?
So the very first thing that we need is any previous records. So either whether it's in a prenatal setting or whether it's in the pediatric setting, any records they have, any testing that's been done, any other consults they've had, those are all pieces of the puzzle that we use to kind of answer our question. And so the very first thing they would encounter if they come to see me is we would sit down, we would talk about why they were there, and we would start reviewing the history, the history of their child or of their pregnancy in that particular case.
And if by chance they haven't had anything done ahead of time, but they're worried about something, they can have all of the testing done here?
So the testing that is done, it really depends. A lot of that is dictated by insurance, but some of the testing can be done actually in-house at Nicklaus Children's Hospital, and some of it we send out to other specialty laboratories depending on what we need to order.
You let them know based on their situation once they're here.
Absolutely.
What made you decide to be a genetic counselor? Why were you inspired?
So I've always been interested in science, and when I was in college, I took a genetics course and became fascinated by genetics. And then when you start looking at your own family history, there are a lot of things you can relate to, because I always say every family history has something.
Absolutely.
And so in combining those, and then I did a lot of volunteer work during my college years with an organization that does a lot of women's health education and things like that. So I started looking for fields that would really combine my interest in helping people, my interest in educating, and then my love of genetics. So I stumbled upon genetic counseling, and that's really kind of what made me hone in. It was the perfect fit for me.
What would you say is the most challenging part of your role?
So I would say even from the beginning of my practice, the most challenging part is when you can't diagnose, when you can't come up with that why answer. Now, over the years of my practice, that's become much easier.
Oh, good. There are less chances of
right.
not.
Well, because our technology has become better and we can diagnose. However, with increasing technology, the ability to interpret results of genetic testing has become more difficult. So even though we can make more diagnoses, the most frustrating part is sitting in front of a family and saying, yes, we have this genetic testing and we either didn't get an answer or it's difficult to interpret. We can't interpret it right now because it's still new technology. So I would say that's probably the most challenging part.
So you really strive for that why, for answering that
Right,
why.
because for families it's important. I mean, even if it doesn't change the management or the treatment for the child, kind of knowing what the cause is can help give them define. Sometimes it can decrease guilt. Maybe they've always thought it was something they did or didn't do. So, you know, parents like to have that answer and we want to have it for them.
I think all of us, anyone who's gone through any health issues knows that the not knowing is sometimes worse than whatever you're going. It's the hardest part. So
yes.
It's great that you're able to give them
Right.
answers most of the time.
Yes.
I imagine. When you talked about technology, it plays a big role. I know that in all of the times that we've discussed health issues here at Nicklaus Children's Hospital, they really have a strong focus on having the latest technology in order to give the best health care. Is that the
Absolutely.
case with genomic technologies?
It is, and it's been very exciting over the past year or so. We've had access through other laboratories to do kind of the latest in genetic testing, which is something called exome sequencing. But over the past year, we've become involved in probably the latest technology, which is whole genome sequencing, which is where we can look at the entire genome of an individual to see if there are any changes that can answer that why question. And Nicklaus Children's Hospital is working on an initiative both in our intensive care units, so in babies that haven't had a lot of genetic testing, but we think may have an underlying genetic condition, and we're doing that latest technology, the whole genome sequencing, and trying to get an answer. And then we do this also in our children who have gone through what we say the odyssey of genetic testing. So are perhaps a little older, have had several genetic tests. We really think it's an underlying genetic condition, but we don't have an answer. And we're doing that same testing on them. And we're doing that, one, to hopefully get a diagnosis. The other reason we do it is because we want to compare technologies and see if we're getting a higher diagnostic rate with this whole genome sequencing compared to other testing. And third is to kind of contribute to the greater knowledge of genomic medicine so that we can add to the data and help answer those for maybe some other clinician in another part of the world. We can add to that information and help them make diagnoses.
Yeah, it really is amazing. It's changing all the time.
It
So
is.
much new information. What do you think is the future of genetic counseling?
So for genetic counseling, I would say that the demand has increased significantly because with genomic medicine, genetics is going to start being part of many medical specialties. So adult cardiology, I mean, it'll touch, I always tell patients, it's going to touch every aspect of medicine.
In some way, sure.
So for genetic counselors, our demand is going to be increasing. We're going to be required to know, to understand more complex genetic technology, and we're going to be required to work or to be asked to work in many different settings.
A lot of opportunities for anyone
A lot of
interested in
opportunities,
becoming a genetic counselor.
absolutely.
What does someone need to become a genetic counselor?
So in order to become a genetic counselor, you need a master's in genetic counseling. There are about 40 programs across the country, which means it's a very competitive process. And you need a master's, and then you need to be board certified by the American Board of Genetic Counseling. Yes.
Now, I'm just curious because I think I hear so often friends of mine, I haven't done it yet, who are turning to these companies who do genetic testing, and then suddenly they're finding out that they do or may have a condition. And are you finding that a lot when patients come to you now?
So we have some that have had that kind of testing, and others that really ask more, is it a legitimate process? Is it something we should consider having? And my answer to them is, you can have the testing, but the most important part of the testing isn't necessarily the paper you get back. It's what you understand about those results and how accurate they are in predicting impacts on your future health. And so in that sense, I think that all of those patients should be, and all of those individuals should be having really good comprehensive genetic counseling so that they understand the results.
I agree, because some of my friends become alarmed to see, and then
Absolutely.
they don't know where to turn. What does this mean? So that's where they would come to a genetic counselor and be able to get the real facts.
Right. And ideally, I mean, like we said before, the earlier the better. So really it would be great if they had that counseling even before. So they really understand what's being tested, what is the accuracy, what is the predictive value. So what is this really going to tell me about my health?
Sure. Anything else you'd like to add? Any advice you have for anyone out there who's considering, or perhaps thinks they have something in their family genetically and they want to know before they have a child? What's your advice to them?
So kind of for two. If someone wants to become a genetic counselor, I really encourage you to do some shadowing with a genetic counselor, see what they do, make sure it's something you really want to do. Also get involved in some just counseling, so crisis counseling, any kind of counseling, because so much of what we do isn't just providing medical information, but it's also helping people cope with that information that they receive. So any experience you can have with the process and learning about it is going to help you in kind of getting into a program and being just an effective genetic counselor.
You have to like people.
You have to like people, and I really feel that in your heart you have to really want to help people and along their journey.
What a great feeling must be when you do that.
Absolutely. It's the best part of my job.
Well, Katherine,
Yes.
thank you so much for joining us, for bringing
Thank
us so
you.
much information
Thank
about
you.
what's going on here at Nicklaus Children's Hospital. If you want more information, if you've been inspired, thanks to Katherine, to become a genetics counselor, and you want more information on that, or perhaps information about the personalized medicine initiative going on here at Nicklaus Children's Hospital, all you have to do is log on to nicklauschildrens.org/PMI. That's for Personalized Medicine Initiative. And thanks once again for joining us. We ask you, as always, to please share this with your Facebook friends. Just hit share when you're done viewing here. We greatly appreciate it. It's the best way that we can all get the word out and inform our viewers. So thank you so much for joining us, and have a great day. Thank you, Katherine.
Thank you.
Now I can see why